For more than a decade now, the number of patients returning to hospitals has been a key indicator of effective health care. Fewer readmissions is better. Duluth-based Essentia has taken a very methodical and, it turns out, successful approach to curbing readmissions, and we'll hear how it works. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Tim Nelson. The Federal Centers for Medicare and Medicaid Services track hospital readmissions and even levy some financial penalties against providers when the agencies think those numbers get too high. In this episode, we're talking with Dr. Cathy Cantor, Chief Medical Officer of Population Health at Essentia, about how a proactive approach focusing on heart health isn't just keeping readmissions down, but keeping patients healthier. I started by asking her just what a readmission was.
So readmissions is really, in CMS's eyes, it's any patient that is admitted within 30 days of an original admission. So say you were admitted for pneumonia, and then within the next 30 days, you had another admission to the hospital, whether it was related to that pneumonia or you had a fall at home. But any cause for readmission in the next 30 days after you're discharged from the hospital is considered a 30-day readmission in CMS's eyes.
And why is that important? What are they looking for? What do they think that tells them?
Sure. It's important for many ways. I think overall, readmissions are not a good thing. That's not a good thing for the patient, for the family, and really for the hospital systems. And, CMS is looking for situations where perhaps patients weren't taken care of appropriately the first time they were admitted. Perhaps they weren't sent home on the correct medication regimen or with the correct instructions. So they're making sure that first admission is taken care of properly and patients are treated appropriately and not putting them at risk when you do discharge them at home.
Obviously, hospitals are very interested in keeping that number down by any number of strategies. Talk to me a little bit about Essentia's success and how they've accomplished that.
Yeah, one of the things we looked at with our patient population, and particularly with our heart failure populations, certainly that's a high-risk population for across the country. So when we looked at our patient population of those with heart failure, what we found was that if a patient with heart failure was connected to the heart failure clinic specialist, their all-cause readmissions in 30 days was less than 0.2%. Which is a very, very low number for a high-risk patient population. However, if a patient had heart failure and was not connected with the specialist heart failure clinic, their all-cause 30-day readmission risk was 21%. So that showed us we had a real opportunity to make sure we were connecting patients that are high risk with diagnoses such as heart failure to the appropriate specialist, the appropriate time, and appropriate follow-up.
And this isn't just a matter of checking a box. I mean, there's actual some care being delivered here that makes a difference. Talk to me a little bit about that.
Yeah, absolutely. So, the heart failure program had a subset of standards that happens when they see a patient with heart failure. But what we did is we relooked at the whole care journey for a patient with heart failure. And we said, where can we optimize this at every point and when the patient's touched and connected with our care team? So we really looked at the entire care continuum. So we connected primary care with heart failure specialists. So we made sure that our education for our patients is the same across the continuum. That way it makes it easier for patients to understand. When you see primary care, you're going to get many of the same education points as you see when you get to heart failure clinic, but also making sure that they had connection points of knowing who to call when they had a question, whether that's the primary care team or a heart failure nurse specialist to contact at any point during their journey if they had concerns. And I think the other important piece is that patient education and them being able to self-recognize, I might be getting in trouble here a little bit. My weight's up 3 pounds, right? I had some ham over at Thanksgiving, making sure that they understand what those triggers are in their mind to call sooner than later.
And how does this translate to actual patient health? I mean, obviously, it's good to have these statistics, but do you have a sense that these patients are actually better off and actually healthier?
Yeah, what we see is that, we had some great patient report outs where not only were they better off and healthier, but they were able to live a life that they had been wanting to live. Meaning that, a patient wrote back to us about being so short of breath all the time. He wasn't able to get out of the house and plant a garden that he'd been wanting to do for many seasons. And so once we connected him and got his everything under control, he wrote us a letter about how that touched his life. He was able to get up and walk around, go out to the porch, you know, plant his garden. And for me, that was really, I think changing in that the sense that, hey, we're not just making them more healthy, but we're letting them live the life that they hope to live.
And obviously, this relates directly to Medicare and sort of CMS and how it operates. But are there any other lessons for caregiving in general that Essentia has taken from this?
I think also be aware of the social determinants of health, those factors that, you know, really we don't see when the patient's right in front of us many times. So being willing to ask those questions is that, do you have a ride to and from your appointments? Do you have, the access to healthy food? Are you able to pay for your medications? These are all things that we need to make sure we ask or give patients the opportunity to tell us about. What we find is that 80% of a patient's health is really related to those things. And we happen to focus on the 20% that we can fix medically, right? So, making sure we ask about that. And then we have those other programs, community health workers. We also have the community paramedic programs where they can go meet the patients where they are. That piece is extremely important, more than ever, to make sure we ask patients about those. I do think the rural piece of the way we deliver healthcare is much different, right, in Minnesota.
Mhm.
Um, so what we did find with this patient population as well was that, when you put them on a heat map of the patients that were connected to a heart failure clinic, we found what we thought we were going to find in that, very hot spots around the major cities. Duluth
Mhm.
and Fargo, but we had real opportunity on the outlying areas. And so it was about also connecting the outlying patients in rural America and rural North Dakota, rural Minnesota, to heart failure clinics in a virtual kind of telehealth way was also extremely important for that project.
Do you think this only applies to Essentia? Are these lessons applicable to other hospitals and health systems, or is this sort of unique to Essentia kind of thing?
Mhm. I think many of the modalities we tried can be, widely used across many healthcare organizations. However, we do have a unique patient population and geography that does spread out those patients we serve into those rural areas. So what we did find is that, the farther out you are, the more miles you live from a major city like Duluth or Fargo, the harder it is going to be for you to access some of this care. So the next step for us was to add a virtual platform to allow these patients to be connected in a telehealth way or a virtual way, without having to drive 3 or 4 hours to seek that care.
Well, congratulations on the success, and I only wish you more.
Great. Thanks for having us and thank you for the opportunity.
Again, that's Dr. Cathy Cantor, Chief Medical Officer of Population Health at Essentia. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.